that according to NASDAQ, about 66.5% of bankruptcies are caused for medical reasons? This is absurd. In fact, here are some other common causes of bankruptcy put right next to it. Yeah, that's bad. Many other countries don't even have this problem. They have something we don't, though, and we should change that. For this reason, I propose that the United States should make a universal healthcare plan, and preferably along the lines of single payer. And so that people like you in the audience, people you know, people you don't know, etc., don't have to worry about losing their coverage or going broke to see a doctor due to injury or illness. And I've done a lot of research on this subject. I skipped the 5th grade. I am done dual credit since 8th grade, and I am currently leading my Vision Charter School class in academics, so you can trust me. So, a few points I'd like to discuss. First of all, our current system is broken and manipulative. Secondly, a single-payer system would fix many problems our current system has. And lastly, many critiques or criticisms of this plan are unfounded or could be accommodated. So, let's begin. First of all, how is our current system corrupt? Well, there are a few reasons. First of all, price gouging is a major issue. Did you know that according to Bloomberg, the average American spends about $1,200 a year on prescription drugs? That's crazy. Higher than anywhere else in the world. Well, this is due to price gouging, where drug companies, because the government isn't putting pressure on them, take it as an opportunity that they can get away with it and jack the prices up to increase their own profits, which works for them, but it hurts you, the people. So, this system also is often confusing and causes people to overpay. How many of you have been confused learning about health coverage and looking at it? I thought so. Yeah. Now, this causes many people to get anxious and overpay because they simply don't know better. Additionally, our current system advantages employers and disadvantages the unemployed and employees. Well, the unemployed, they have Medicare and Medicaid, but those are often defunded, and often don't go far enough, or don't have restrictions that they cannot meet to get it. So, many problems with that. Additionally, by giving employers time healthcare control, because often many employers provide healthcare plans, they can yank that away from you if you get fired, which happens quite often and is power they should not have. In conclusion, current system is broken, but how does single payer make it better? Well, Harvard defines single payer as a public or quasi-public entity taking control of giving everyone health care instead of just leaving it to a few private companies. And in that definition, our answer can be found. But just see how broadly it's worked. Here are some of the countries that have universal health care. Canada, Taiwan, and South Korea have it, single payer, and according to the New York Health Department, about 32 countries in the world have it. All these countries in blue have it. So, this system fixes a few things. First of all, by giving the government power to control drug costs and pressuring drug companies, it disincentivizes price gouging and thus lowers the cost for all of the prescription drugs. Additionally, by having healthcare tied to the government and not your employer, as is often the case, if you get fired, you can still see a doctor just fine and don't have to worry about it. And lastly, for people, it's often cheaper. And so, there are many benefits of single payer, but some people are against it. Why? Well, first of all, there's the idea that it's socialist or communist, which frankly isn't a valid criticism in my book because it's based on two logical fallacies. So let's just skip that. But there's also another idea that implementing single payer would be too costly and would bankrupt us because it costs more than our current one. However, that's not the case. According to Politico, the cost of implementing single payer would be about $20 trillion to $36 trillion over the next 10 years. Sounds like a lot of money, does it? But it's cheaper. According to Politico, as well, they also said that keeping our current system would cost us $52 trillion. And I don't know if you know basic math, but 52 is greater than 36. So, single payer would probably be cheaper. And there's also the idea that by implementing single payer, we would run into an even worse shortage of healthcare workers. However, if this was even the case, it could be fixed by reforming medical school. Because, for example, Jonathan Oberwarten, a professor of social medicine at the University of North Carolina in Chapel Hill, said that countries with single-payer systems typically have this problem much less than in the U.S. System does. And if this is a problem, by making medical school cost less and be shorter, or we could take away some of the disincentives some people have for going into those fields and thus have more workers. So, let's recap. First of all, our current system is corrupt and broken. Secondly, single-payer system fixes many problems our current system has. And lastly, many problems with this plan are either unfounded or could be accommodated for. So, remember that statistic at the beginning? If we implemented single payer, we could bring that down a whole lot, maybe even to zero. So, I implore you to get out there and advocate for this mutually beneficial change. And who knows, it may save a life in the process. Thank you.